John Kahn will be addressing in the next short while. We established, as you can see right in front of us, and Facebook NPAFInc, Facebook page NPAFInc, all the terminals started going live one after another, dear friends. This is now, we are trying to bring a show for healthcare in the segment of cardiology from the most eminent scholar, Dr. Joel Kahn. Before I open up the floor, couple of housekeeping points. He is extremely busy, doctor. Do not overwhelm him by shooting him emails seeking medical advices. Before attending and listening the show, do follow your country's uh, discipline, medical advisors, and after the protocol only, you please reach to him. Dr. Joel Khan, we established the channel, as you can see in the background on the top. He is with us today. We were trying to get him on board for quite a long time. Today, we are fortunate that he is with us from Detroit, United States. Dr. Dr. Joel, we will start the proceedings of the day with in-depth honor, reverence, and privilege. It's my great pride and ultimate honor to have Dr. Joel Kahn with us today. He completed his graduation from Michigan University. At present, he is with the Wayne State of University School of Medicine at Detroit, United States. He is a prolific writer, great thinker. When I invited him, he had probably 3 licenses of 3 states, medical council. Now he has been awarded the 4th one. Extraordinary doctor, thinker, writer, repetitively invited by Fox News, Reader's Digest, so on and so forth. So not wasting any time further, I would like to invite Dr. Joel Kahn to address the gathering today. Dr. Joel, floor is yours.
It's my great honor too. And in case anybody's wondering, the floor is mine, but I'm not standing on the floor. I'm standing on a treadmill because generally when I'm doing computer time, I'm on a treadmill desk. Just a little more activity, a couple more steps a day. I am a lifestyle cardiologist, a preventive cardiologist, and if I don't practice what I preach, by getting my sleep, getting my steps, eating my fruits and vegetables, I'm not much of an expert. So I am talking to you while I'm walking on a treadmill. That doesn't mean you need to do that, but it's something I've added recently to my home and my office, and it's a joy. But I want to speak to you a little bit about a very important message. Just very briefly, I grew up in a home in Detroit, Michigan, USA. We kept certain dietary laws called keeping kosher because of our Jewish faith. So I didn't eat pork. I didn't eat meat and cheese together. And the only reason I tell you that is I already knew I wanted to be a doctor and a cardiologist when I was quite young. When I went to the university, my only option was the salad bar if I wanted to honor my diet and my faith. And I actually decided at age 18 just to stick with the salad bar. So I've been vegan for 45 years. Not everybody can say that. Some people can say their whole life, but for me it was 18 years not, and now 45 years going strong. Only fruits, vegetables, beans, peas, lentils, grains, water, tea, coffee. It has helped my health enormously, but I never expected it to be part of my medical practice. But as I went through medical school and beyond, I started hearing about nutrition. Not a lot, but hearing. And my ears were ready because I was already the one at a medical meeting that wasn't eating eggs and bacon. I was having a bowl of oatmeal from right at the beginning. So after many years of treating heart attacks, being what might be called a traditional heart specialist, I changed completely to all prevention, all natural, all lifestyle. one more word I'll throw out, all integrative. I just basically feel like I have a big toolbox. I have prescriptions, and I have surgery, and I have stents, and I have other ways to approach heart. But I have a lot now about sleep, dental health, stress, nutrition, meditation, yoga, breathing practices, anything to help my patient get through life. But the number one thing I want to talk about with that background is how to find out if you have heart disease and how to get on top of that early. Sadly, even last year in 2020, and I can only give you United States statistics, despite 2020 being a year that was all COVID, all pandemic, the number one killer of men and women in the United States was heart issues, heart attacks. Even though it was reported maybe they had dropped a little bit, it still was number one. Twice as many people died last year of heart attacks and heart disease in the United States as they died of COVID. In fact, COVID was number 3, cancer is number 2. And it's probably similar in Canada and many other countries around the world. So we should have a pandemic approach to heart disease. We should be testing for heart disease. We should be identifying high-risk people. We know now for the virus, being elderly, obese, diabetic, advanced age, put you at more risk. Well, we know the same things, but we know them much better for heart disease. The current medical model, just think about this. If you go to a doctor once a year or once every couple of years for a checkup, and you're 45 years old, the doctor may ask you, or the nurse, do you smoke? Good question. You don't want to smoke. Do you have any exercise plan? You probably won't get asked, but if you do, hopefully you do some walking or gym or swimming or something. You might get asked a little about your diet. Probably not. You probably will have your blood pressure checked, your cholesterol checked, your blood sugar checked. Boom, done. And your doctor might say to you, I'm concerned about colon cancer. We're going to schedule you for a colonoscopy. And your doctor might say to you, if you're a woman, we're concerned about the risk of breast cancer. We're going to schedule you for a mammogram. What are they scheduling for your heart? Nothing. But you're 45 years old sitting in that office, particularly if you're of South Asian descent, like our host, Indian descent, where we know heart disease is 2 or 3 or 4 times more common in that ethnicity. There's nothing being done to detect heart disease early. Let me say that again. There's nothing being done to detect heart disease early. Your cholesterol could be 300 and you have clean arteries. Your cholesterol could be 150 and you're 2 weeks away from a heart attack. Generally, high cholesterol is a danger. Generally, smoking is a danger. Generally, diabetes and high blood pressure and a big waistline are dangers. But doctors can't tell. So this is the message. I use a hashtag on social media, test, not guess, which is to say, you're 45 years old, you can find out. You're 50 years old. You can find out if you're starting to develop hardening of the arteries. Hardening the arteries, we call it atherosclerosis or plaque. That's another word. Plaque is the junk that grows on your teeth, but plaque is also the junk that grows in your arteries. Cholesterol, calcium, white blood cells, scar tissue. You can find out. And what I follow is a teaching. We should be as aggressive with early detection of heart disease as we are with mammograms for breast cancer, colonoscopy for colon cancer. But it's not done even though the technology is there. So I'm talking directly to you. There is a test. Remember, hashtag test, not guess. Let me give you an example before I tell you what I recommend you do. Take a look at age 50 at somebody you know the name of, Winston Churchill. Winston Churchill, Prime Minister of England, I think twice, if I remember. Winston Churchill at age 50, heavy, cigar smoker, I don't think you're going to find Winston Churchill in a gym, eating lamb and other foods. How old did Winston Churchill live to? 91. How many doctors would have said to him at age 50, Winston, keep up, stay obese, don't exercise, eat your cigars, eat your lamb. He lived till 91. We would not have predicted that. And on the other hand, let me bring up a name, Jim Fixx. Jim Fixx was a runner in the 1970s. He wrote a book that was a New York Times bestseller called The Book of Running. It was a huge smash. Started a lot of people doing marathons. Jim Fixx looked amazing at 50. And what do you think a doctor would have told Jim Fixx at age 50? Jim, you got a long and healthy life ahead. Jim Fixx died of a heart attack at age 53 while running. And I want you to know that your doctor, your nurse, are not that good, nor am I, at looking at you, even including your lab work, even including your blood pressure. We can make some general trends. So, hashtag test not guess. There is a technology. I did not invent it. I'm not going to win the Nobel Prize in medicine for it. But the technology was invented in 1990 called a heart CT scan. CT, CAT scan, you know the term. CT scan or CAT scan stands for computerized tomography, but everybody calls it a CT scan. And the technology was developed, just listen, 1 minute. You're on a stretcher, you're 45 years old, you don't know if you're Winston Churchill living to 91 or Jim Fixx dying tragically at age 53. You go in a circle, that's called a CT scan. You hold your breath for 15 seconds and you go home. That's the test. I didn't say needle, I didn't say pain, I didn't say inject anything, and all you gotta do is hold your breath. You can even wear your shirt while you're doing it. You don't exercise. That is called a heart calcium, like you've heard the word calcium in orange juice, calcium in leafy greens, calcium in milk. Heart calcium CT scan. Takes 15 seconds, painless, not claustrophobic. When this was developed in 1990, it required a special CT scanner, very expensive technology. So when it came to my town, Detroit, Michigan, people were paying over $1,000 US to get this CT scan to find out if they had silent hardening of their arteries. Nowadays, fortunately, it's not 1990 anymore. And any CT scanner can do a heart CT calcium scan. So in my city of Detroit, you can pay now $75 US or $99 US to get this test. Our insurance doesn't cover it in the state of Michigan. In the state of Texas, insurance covers it. Even more interestingly, in the city Cleveland, Ohio, the university offers it for free. You call up and schedule, you go in for 15 seconds, they do it as a public service for free. What is the big deal? Because that is the most accurate way at age 45 or so to know if you're on the path of going to Winston Churchill and living to 91, or tragically getting a big wake-up call. What if your doctor calls you and says, good news, your heart calcium CT scan is 0. That's what you want. That means no calcium plaque was found. You have a very good outlook. You should work on your diet. You should work on your exercise, your sleep, your dental health, and other features. But you're in very good shape, and you probably don't need prescription drugs unless your blood pressure is sky high or your blood sugar is sky high, but work on it with diet. Like I teach my patients, watch the documentary, Forks Over Knives. Watch the documentary called What's the Health? Watch the documentary called Game Changers Movie. Maybe read my book called The Whole Heart Solution, or another book I wrote called The Plant-Based Solution. But what if your doctor calls you and says, Joe, Barb, Steve, David, Mary, your heart calcium CT scan came back and it's not 0, and it's a number above zero, maybe 50, maybe 500, maybe 300, maybe 900. Your arteries are developing aging and hardening of the arteries, plaque. Now we know you're on your way to being more like Jim Fixx than Winston Churchill, more on your way to being at risk for a heart attack than living a long life. And that's the person that needs lots of attention, maybe medication, maybe aspirin, maybe cholesterol lowering, a big change in diet, whole food, plant-based diet, like Dr. Dean Ornish has taught and researched, like Mr. Nathan Pritikin has taught and researched, like Dr. Caldwell Esselstyn at the Cleveland Clinic has taught and researched. But if you watch Forks Over Knives, you'll know all that, or the Game Changers movie, you'll know all that. So this heart calcium CT scan in the United States, easy to get. In Manila, Philippines, easy to get. In Bangkok, Thailand, easy to get. In Canada, a little tricky with your medical system. You have to hunt around a little. Not because it's expensive, but your medical system is a bit constipated and slow. But remember, I told you this technology is from 1990. So there are thousands of research papers. And just in the past 2 weeks, I read one new research paper that looked at the question, what if you're young, but you have what we call a risk factor? You're in your late 30s, early 40s, and you have high blood pressure, or your doctor said your blood sugar's up, or you smoke, or your waistline is big and you're obese, or your father had a heart attack, or your mother had a bypass operation, or your brother had a stent. What if you're like that? What age should you do this? The conclusion was, guys, about 43 years old. I'm surprised the recommendation for women was wait till you're in your mid-50s, really till about menopause is started and over. I don't completely agree with that. If I have a woman and she has either a concern or a high cholesterol, a high blood pressure, a high blood sugar, I'll order the CT scan for $75, or they can drive to Cleveland, Ohio, do it for free. I'll order it at a younger age. Hashtag test, not guess. Now, if you can't find a place to do a heart calcium CT scan, or maybe your doctor doesn't want to order it. I've seen that many times. That's not a value. It's a value. You want to be a zero. I'm 63 soon, and I've been a zero my whole life. I'm still a zero. I have no plaque in my heart arteries. I think a lot of that is that I started eating a whole food, plant-based vegan diet when I was 18 years old, and I haven't put any meat, any cheese, any eggs, any dairy, any fish, any poultry, any pork in my body for all those years, which has been a good thing, fortunately. But you want to get, what if you can't get the scan? Some people can arrange an ultrasound of the arteries to the brain. You have a right carotid artery, left carotid artery. It's not quite as good, but if you can find out if they're clean, at least you have a clue. And if you find out that there's some plaque developing, work harder, eat better, exercise more, get a walking treadmill desk, do something. Read my book, Plant-Based Solution, How to Reverse Heart Disease. Do something, okay? Hashtag test, I guess. And I want to talk about maybe two other things. How to know if you are at risk, even if you think you're healthy, like the runner, Mr. Jim Fixx, who did not make it past 53. And that is beyond the routine testing your doctor does. Ask your doctor for 2 extra blood tests. Ask for a blood test called C-reactive protein, like the letter C, reactive protein. We call it CRP. It indicates if you have inflammation. Maybe your diet is bad for you. Maybe you're allergic to something. Maybe your teeth have an infection. Maybe you're overweight. Maybe you have sleep apnea or you have psoriasis on the skin. If your blood shows your C-reactive protein is up, you've got to work on those things and make changes. because inflammation is a sign that the body's not in a healthy state. The other test to ask your doctor for, this is one of the books I've written. You see the title, it's an awkward word, lipoprotein A, L-I-P-O protein A. And in fact, it's actually pronounced lipoprotein little a, because it's not a capital A, it's never a capital A. That is a blood test for a kind of cholesterol you inherit from mom or dad or both. Is it rare or is it common? Well, there is a kind of genetic cholesterol problem, and the doctors that identify it won the Nobel Prize in Medicine. That condition affects 1 in every 250 people. This cholesterol, 1 in 4, 25%. So if you're listening now, 3 people don't have it, 1 person has it. You might be the person. And you inherit it, it's genetic, from the day you're born. So your whole life, you're walking around with a high cholesterol. The thing is, though, this doesn't show up on the routine cholesterol test. You have to ask for it. Dr. Jones, Mr. Smith, the nurse, whatever it is, can you do a blood test when you're checking my blood? Will you add this in? I've written a book on it. I've written many articles on it, videos on it. Because you might want to know if you're at risk. You might want to be accurate with your health. And if you find out you didn't inherit it, it's good news. And if you found out you did inherit, there is no prescription drug right now, but you want to work harder. You want to get my book, The Plant-Based Solution. Eat better, sleep better, move better, lose that weight, get the cholesterol great, get the blood sugar great, get the blood pressure great, don't smoke, go to the dentist, do your meditation and relax, and manage your stress. So that's what you can do about it for now. So you've heard my message. Let's take heart disease, even if today you're listening, but you say, but I eat well. I have oatmeal for breakfast and salad for lunch and bean soup for dinner. And I go to the gym and I don't smoke. You still could be gym fix, and you still should have, in my recommendation, a heart calcium CT scan around age 43, 45, 46, hashtag test and I guess. Get a couple extra blood tests. I don't want you to be a heart statistic. I don't want anybody in your family ever getting a phone call. Say, how did we not know? How did Mary or Bob have a heart attack? They were at the doctor last month. How come we didn't pick it up? You can always pick it up with technology. Hashtag test and I guess. So I think I'll stop there and not overwhelm you, but certainly feed you what I think is the most important message I could share with you today.
Dr. Joel is an eminent cardiologist from United States. He resides in Detroit. He is with Wayne State University of Medicine at Detroit. He is a prolific writer, great thinker, and his talks benefited lots of people globally. So we decided to invite him. We were trying to get his appointment for a very long time, and today we were fortunate to have him with us. I presume that you enjoyed his time with us today. If you have any question or inquiry, feel free to send him an email. He generally responds the email very promptly, professionally, to the point, but do not make him feel overwhelmed. His podcast is available on Apple. And before we let him go, I would like to run one small AV for Dr. Joel Kahn. This is his clinic at joelkahns.com. All the podcasts are available on his website. You can listen to him on iPad, iPod, on TV shows here. So he's available And for seeking healthcare, you do not necessarily need to run after him as an individual case. However, feel free to seek his appointment. His contact details are there on his website. It's an indie pride and honor for NPF to bring him today from Detroit. We are inaugurating our newly cutting edge transmission where he is the first guest of honor from US. Thank you so very much, Dr. Joel. Your time
Thank
is
you,
taken up in
sir.
a right spirit, and we are very thankful to you. Thank you, Doctor.
All right, you have a really wonderful day. I'll sign off. I will simply say, because of technology like this and Zoom, we do take care of people all over the world, and we give second opinions in Malaysia, in Australia, in Mumbai, or wherever it is. So certainly Canada. Hopefully the border will be back open because Detroit is right across the river from Canada.
Exactly. I'd
Anyway,
been to Detroit in 2002, and I know how close it is from Niagara.
no
So,
gloves. You can get a golf ball across the river if you're a good
exactly,
golfer.
exactly, Doctor, exactly.
I'm not a good golfer. Anyways, have a wonderful day. Thank you.
Thank you so very much for your time again. Thank you. NPF is blessed. So that was Dr. Joel Kahn with us. Dear friends, this is NPF. It was indeed an honor. We received a lot of hits, likes, and bites through LinkedIn Live, through Periscope, whatever the terminology may be, hashtag or likes or sending the flowers. It's all overwhelming, expressing of gratitude and vote of thanks. I thank you so very much for bringing the first ever presentation from United States, from eminent scholars. If you have a license to operate the patient, what all I want to what all I want to convey to you is that surgical intervention is not the only option. There are substitutes available, and here in United States also socioeconomic conditions do play a role in treating the patient. So we should look for economical and effective options before taking the patients on bed. However, doctors are the best judge and jury. We do not try to encroach upon their individual skills and wisdom. Dr. Joel Kahn shared a vision that we will remember as a valuable treasure for days to come. Thank you very much to Dr. Joel Kahn. Thanks to TechNL and the team. And thanks to all of them who supported us. Thank you.